Imagine waking up daily with pain in your abdomen, back, and even sometimes legs. Imagine that this pain is so bad at times that you can't even get out of your bed. Now imagine that you know why you have this pain, but you also know that there is no cure. That's what it's like for the 1 in 10 women who suffer with endometriosis. Endometriosis is a painful condition caused by the overgrowth of tissue and scarring caused by a hormonal deficit. Many women who have been diagnosed with endometriosis were not given the proper education that they needed to make an informed decision about their best treatment option. Hormonal therapy can be the best treatment option for a woman with endometriosis, especially one of a younger age. The reasons we will discuss that hormonal therapy is the best option is it's the more natural option. The second reason we will discuss is that it is the less invasive option. And the third reason we will discuss today is that there are less long-term risks associated with the use of hormonal therapy than with a hysterectomy. Hormonal therapy is the more natural option. Hormonal therapy treats endometriosis by using the hormones that occur naturally in the body to help prevent more damage and scarring that can occur. With a hysterectomy, a woman will go into menopause just days after the surgery is complete. This is not a natural occurrence, especially for a woman in a woman of a young age, and can have many long-term risks and effects. The fact that hormone therapy is the more natural option is great, but it's also the less invasive option. A hysterectomy, or the surgical removal of a uterus, has a long downtime, and healing typically takes 6 to 8 weeks. That's if there is no complications from the scar tissue that is already there. Hormonal therapy can be invasive. The most invasive is in the form of injections, and these can be given monthly or weekly, and your physician can teach you how to do them yourself or teach a loved one how to do them. There are also less long-term effects and risk associated with the use of hormonal therapy than with that of a hysterectomy. Hormonal therapy, unfortunately, there is no cure for endometriosis, and both treatment options have risk and side effects, but there are less long-term risk associated with the use of hormonal therapy than with a hysterectomy. Hormonal therapy can cause depression, difficulty sleeping, difficulty losing weight, bone loss, and heart problems. These can be helped by diet and exercise both during and after the use of hormonal therapy. With a hysterectomy, there are great long-term risks. There are risks of developing heart problems, especially with a woman younger than the age of 35. When a woman younger than the age of 35 has a hysterectomy, it puts her at a greater risk for bone loss than that of the use of hormonal therapy, obesity, heart disease, high blood pressure, and can cause an abnormal blood fat level. These risks put the younger woman at a greater risk of having a heart attack or a stroke. Today, we have discussed the reasons why hormonal therapy can be the better option for a woman, especially that of a younger age. Today, we discussed how hormonal therapy is the more natural option, how hormonal therapy is the less invasive option, and finally, we discussed how there are less long-term effects than with that of a hysterectomy. Hormonal therapy can be the best option, especially for a younger adult woman with endometriosis. Just think of all the women before who were diagnosed with endometriosis that were not given the proper education and had a hysterectomy, and now have to deal with the side effects, the risk associated, and the continued pain that they still have.